Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down issues, innovations, and policies shaping the future of healthcare. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Today, we're taking you inside EULAR 2026 once again, the annual Congress of the European Alliance of Associations for Rheumatology. Each year, thousands of researchers, physicians, healthcare professionals, patient advocates, and industry leaders gather from around the world to share new research, discuss emerging treatments, and collaborate on improving care for people living with rheumatic and musculoskeletal diseases. But EULAR is more than just a scientific conference. It is a place where research meets real-world patient experience. And that's one reason GHLF participates every year. Joining me today is my colleague, Dr. Shilpa Venkatachalam. Shilpa serves as a Director of Patient-Centered Research at GHLF, where she leads initiatives designed to ensure that patient experiences, priorities, and outcomes are incorporated into healthcare research. Shilpa, welcome back to the Health Advocates.
Thank you, Stephen. Thanks for having me today.
Let's start with the basics. For listeners who may not be familiar with EULAR, what is it and why is it such an important event in rheumatology?
So EULAR is the premier scientific and advocacy body for rheumatic and musculoskeletal diseases in Europe. So essentially, it's the annual State of the Union, think of it that way, for the entire field. And the closest American equivalent is ACR, or the American College of Rheumatology. And together, what they do is they set the global tone. So many of the most important guidelines for rheumatoid arthritis, lupus, and others are generally issued jointly by both organizations. So you can think of them as two pillars of the same house. Now, over about 12,000 health professionals attend annually alongside patient advocates. And what's really important, at least for Global Healthy Living Foundation, is we're a patient advocacy organization, is EULAR's what's called the PARE program, which formally embeds patient voices into the scientific program, which is really a big part of why it matters beyond just the science.
You tend to think of conferences like EULAR as primarily being for physicians and researchers. Why is it important for groups like GHLF to be present?
Yeah, so that's a great question. So for patients, this is where future treatments are essentially born, right? So the drug your rheumatologist is going to prescribe, say, in 5 years, is being debated here today. And critically, the question of whether a clinical trial measures what you actually care about, and by you, I mean the patient, your ability to work, sleep, hold your child, go to graduations and other social events, gets decided in rooms like this one at EULAR. So when patients engage in spaces like EULAR, everything changes, right? The science changes, what we measure changes, how we measure changes, what's important changes. And when they don't participate, it quite simply doesn't. And so because science is incomplete without the patient perspective, it is really important for advocates, patient advocacy organizations, and the patient voice to be one of the central voices in spaces like EULAR.
And you specifically presented a poster on hidradenitis suppurativa. Can you tell us about that research and what you found?
Yes, so we're very, very excited to present a poster on HS, or hidradenitis suppurativa, which is a chronic painful inflammatory condition. It's a skin condition. And the project actually came directly from the HS community that's part of the Global Healthy Living Foundation's ecosystem, and what patients were telling us via that community. And so by the time patients got a diagnosis, how many years they'd lost, right? We used focus group discussions. We used a rapid cycle polling, community polls to capture why this delay keeps happening in a disease like this one. And we tried to understand it from patients' own experience and in their own voices. So again, this is a very, very painful inflammatory skin condition causing recurring abscesses and lesions, most often in the underarms and in the groin. And so it also comes with a great deal of stigma. Our data, for example, showed more than a third of patients So that's a pretty big number, right? Waited over 6 years for a correct diagnosis. Imagine going for living with a disease without a diagnosis. That means you can't start treatment. So in our focus group, several people traced their first symptoms back, in fact, to ages 13 and 14, but it weren't diagnosed sometimes until their 30s or 40s. So, really heartbreaking. And we found that the most consistent barrier were symptoms being written off, sorry, as a hygiene or infection issue. So, again, this is a lot of stigmatization, right? One participant, in fact, told us that they saw 4 dermatologists before getting answers. The contrast case was striking. There was one patient diagnosed within a year and had a single provider who knew to refer them to the right specialist. So, the takeaway for clinicians when a patient keeps coming back with recurring painful symptoms in those characteristic locations is really to dig deeper. And that's what we were trying to get across. It has recognizable patterns. And for patients who hear themselves in these stories, we built with the support of UCB, which is a pharmaceutical company, we built a HS diagnostic accelerator, which you can find at GHLF. And that diagnostic accelerator is meant to help patients identify their symptoms, talk to their clinicians better about this condition, so that clinicians can then help to get them to a diagnosis faster and get faster treatment.
And you also had a poster on, or GHLF had a poster on Sjögren's disease. And what was that about?
Yeah, so Sjogren's is another chronically under-resourced condition relative to how much it disrupts people's lives. Again, this is a systemic inflammatory condition, and patients told us that they felt pretty lost after diagnosis. They were sort of handed a label, but not a roadmap on how to navigate the many challenges that come with living with these conditions. So we can conducted a structured international survey, again, co developed with patient partners, and a lot of people, I think more than 200, actually responded. The top priority reported by 83% of those people who took the survey was better information, requirement of better information on managing symptoms and flares. Um, the other thing that we see repeatedly that keeps coming up across diseases, inflammatory and systemic autoimmune diseases, is fatigue. And this came up again and again, even with the Sjogren's community, which really matters because it's one of the most disabling features of Sjogren's disease, but one of the least understood in clinical care because it doesn't show up in blood work and labs, etc. So by and large, I would say 3 gaps stood out. Systemic symptoms like musculoskeletal and neurological issues weren't being recognized, is what we were told. There was almost no guidance around hormonal transitions like menopause. Again, a very under resourced area. And even though many patients were reporting worsening symptoms during that time, they felt overwhelmed navigating a disease that touches nearly every organ system with very fragmented care. So, these are the messages we wanted to get across the scientific community to help support better care, to help support better and outcomes for patients. And so, for people, for the community, what we want is more evidence based information, more support, and understanding the priorities that patients put up there. What symptoms do patients need to be addressed in order to feel better, alongside, of course, clinical control of the disease?
Absolutely, yeah.
Just one thing to add, and I know you'll reiterate this as well. At GHLF, we have a lot of support for the Sjogren's community as well. So if you're looking, if you're looking for additional information, or you're just diagnosed with Sjogren's, then please know that ghlf.org has a ton of resources and support for you.
Did you see any evidence at EULAR that researchers are placing a greater emphasis on patient-reported outcomes and patient-centered research?
So absolutely, Stephen, is a really good question. It's actually one of the most meaningful shifts that I've witnessed in the field. Let's just go back even 5 years ago, right? Patient-reported outcomes were a secondary endpoint, almost like an afterthought. Now they're increasingly the primary measure of whether or not a treatment actually works. And the old model was design the study, run the trial or the study, then ask patients if they liked it. The new model now starts with patients asking, well, what matters enough to even study this? Fatigue, cognitive function, brain fog, work participation, outcomes that never made traditional trials because they were considered too soft are now being integrated. And so EULAR has been a real driver of this, especially with their PARE track. And what we've noticed at this Congress is that patient involvement is becoming an expectation. It's not an exception anymore. So researchers are now increasingly being asked and sometimes required actually to demonstrate how patients shape their study. Is it patient-centered? Is it patient-designed? And that accountability is new and it really matters. So involvement still varies widely in quality. And, as we say at GHLF, ticking a box is not genuine partnership. Our job is really to keep raising that bar.
Absolutely. Well, this has been great. Thank you so much for all that you do, of course, on behalf of patients. And I get to see it every day, day in and day out, all the great work. And it's thank you for sharing it with the audience, with our patients, our community, and in the theme of this episode, thank you specifically for going to places like EULAR, going to conferences, and making sure that the patient voice, patient-centered outcomes are part of that equation. And it's fascinating to hear the difference in terms of how patient-centered outcomes are seen in the community, in the rheumatology community today versus a decade ago, as you described it earlier. So that's fantastic. Thank you.
Thank you, Stephen, and a big shout out to our patient community who, relentlessly and generously continues to participate in these efforts, and also to the clinicians we work with who are always committed to bringing the voice of the patient in everything that they do. So again, thank you for having me today.
Shilpa, thank you for joining us. One of the things I appreciate most about conferences like EULAR is that they remind us that healthcare innovation is not just about new medicines or new technologies. It's about understanding patients better. This year, GHLF contributed important research on both hidradenitis suppurativa and Sjögren's disease, while also helping to ensure that patient experiences remain part of the broader scientific discussions. And that's exactly where patient advocacy organizations can make a difference. By connecting science, medicine, and lived experience, we can help ensure that innovation ultimately leads to better outcomes for the people who matter most, patients. Thank you to our listeners for tuning in to The Health Advocates. Find us wherever you listen to your podcasts, and be sure to leave us a rating or review, as it'll help others like you find us. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.